Thank you, Councillor. Minister, I just remind you yesterday, as one Waterford representative to another, the acceptance by government yesterday of our regional group motion on mental health. And I point out to you that one of the key asks was a national lead on mental health issues, and I hope that you will be able to implement that hopefully as soon as possible, and also highlight to you, as you well know, the significant deficiencies in mental health services within University Hospital Waterford. Minister, since the beginning of the COVID lockdowns, there has been a lot of public discussion regarding the challenges and issues of mental health and the need for renewed government emphasis in terms of resourcing and prioritising within the sector. The present legislation being tabled to relocate the Central Mental Hospital from the 170-year-old facility at Dundrum to a new purpose-built centre in Portrane, North Dublin, is to be welcomed. The buildings at the current Dundrum premises have been unfit for their modern repurposing for many years. They have had capacity and waiting list issues and cannot continue to provide or scale to the needs of service level required for a modern national forensic mental health centre. As part of its remit to the prison services, a significant problem of prisoners being held in secure observation cells, sometimes for weeks and months at a time, while waiting transfer to the Central Mental Hospital, was noted in a 2019 report. Indeed, the Irish prison services have raised safety concerns over the risks of safely managing mentally ill prisoners while they await transfer to the CMH for a number of years. The increase in bed capacity in Portrane will add 67 additional beds over the existing bed capacity on offer in Dundrum, and this is to be largely welcomed. Significant questions, however, need to be asked if this expansion will be enough to cover the increasing trend in prisoners being found not guilty by reason of insanity in the courts. This fear was expressed by the Executive Clinical Director of CMH, Professor Harry Kennedy, who has specifically questioned whether the proposed additional capacity in Portrane might not be overtaken in the near future if the present sentencing trends continue. He also points out that the National Forensic Mental Health Service bed-to-population ratio shows that Ireland has 2 secure beds to 100,000 population, as opposed to most modern European states having in excess of 10 per 100,000. That's 5 times more than our national number. He points out that even with the full 170-bed complement becoming operational in Portrane, Ireland's ratio of forensic mental health beds increases to just 3.5 per 100,000 people, which is still a third of the average in modern European states. We have to hope that Professor Kennedy's reservations will be assuaged by government's stated intention to expand other elements of the National Forensic Mental Health Service at St Ida's Hospital in Portrane. It has long been observed that a society can be judged by how it treats its most vulnerable, and included in this category are those who have come through the courts and face committal to the Central Mental Hospital. But society too has a responsibility to all of its other citizens to ensure that those requiring such help receive it, but that their detention or subsequent release is managed to the highest standards of forensic psychiatric medicine, along with prison service rehabilitation protocols. In the legal renaming of St Ida's as the new Central Mental Hospital, I presume the proposed legislation has been rigorously legally reviewed to ensure that those who are presently resident within the service cannot appeal or interfere in any way with their original committal orders or the duration or terms of their sentences as a result of this legal name change, governance order or place of domiciliary. One hopes too that the new facilities and environment that inpatients will live in at Portrane will help in their treatment and improve their quality of lives. The lawful transfer and future detention of patients at Portrane, County Dublin, raises another very important issue for Dublin residents. That is the redevelopment of the current Dundrum site post the hospital move. This is an area of Dublin which has long been known as a fashionable and desirable precinct of the city, and it has many fine amenity opportunities adjacent. The 11.3 hectare site at Dundrum must present a very significant opportunity for badly needed housing starts in Dublin. Indeed, the Land Development Agency, in reviewing the site, has suggested that up to 1,300 new homes can be created in an entirely new neighbourhood. Given the significant financial benefit that will accrue to the state as a result of repurposing this land area, perhaps government should look at ring-fencing a significant portion of this windfall to the future development of forensic mental health services in Ireland. This would signal a changing perspective on the priority and needs of those resident in the Central Mental Hospital, and will continue the ethos begun in Dundrum 170 years ago in providing care, treatment and rehabilitation to mentally ill offenders for years to come. With the relocation of the CMH and a possible residential redevelopment of the Dundrum site, for the first time, hopefully the State can close the door on using Victorian-era facilities, which are, for the most part, largely unsuitable to providing modern medical services to the people of Ireland. For those vulnerable and disadvantaged who may find themselves residents of the CMH, the hope would be that the change proposal being discussed here today will deliver significant medical and clinical improvement to their lives as patients, and will help staff and clinicians promote and continue to achieve the highest standards in service delivery at the new National Forensic Mental Health Service Centre, the Central Mental Hospital, Portrane, Dublin. New medical advancements in recent months have signalled a door opening to the COVID challenges we have been facing for the past 10 months. Hopefully, too, with the opening of the doors at Portrane, we are witnessing a newfound perspective and priority in government circles to provide further resourcing to meet the needs of those in our population faced with mental health challenges, regardless of the circumstances in how or where they present. Caramagat.